I was hoping to have a sort of a PDF or something that could open up outside, but it's okay. I can manage.
So I don't know whether we're online next. Hi, this is the seminar. Hi guys, sorry, we're just getting ourselves together after a workshop. This is a seminar on food care and spatial accessibility from Juan Carrasco at the University of Concepcion in Chile. And I will pass him on to you now. There are people just coming into the room, so you'll have to just bear with us for 5 seconds.
Let me try to scroll just to be exactly. I think it should work.
We're online now. In please, because we've got people sitting online. Thanks.
And I managed to put it up like that, but it's okay.
Take it off. Be quiet because we're not. Thank you.
Okay. Hello, everybody. I guess this was Tim's idea to have a keynote at the end of the session. So don't blame me first. And the second is I'm in between you and the dinner, so I will do my best to keep it up. Well, my name is Juan Antonio Carrasco. I'm a professor at the Department of Civil Engineering at the Universidad de Concepción. I'm also part PI of the Center de Desarrollo Sustentable, Human Development Sustainability Center. That is a large project that we are very happy that we renew it. We have been for 13 years over there, and then we renew it for 10 years more, funded by the Ministry of Science. I will talk about care again. We haven't had enough about care, so I thought it was a good idea to do that. And when and I really thank Karen for the opportunity to talk with this audience. And I was, and she said very, very, I don't know, not so precisely. You can talk about the things you have done in the past. So I have 3 things that I have done in the past, and I didn't know what to choose, so I chose the 3 of them. But I would prefer, but I will try to keep it short, just to highlight some of the things that we've been working and worrying in the past, which is basically food, care, and accessibility. That would be the 3 aspects. Why that? Basically, I think they have a common theme regarding care, but also regarding justice, and in different scales. I like very much what Tanu said about the micro, meso, and micro levels, but also in the sense that I think they highlight some of the questions that we have had in the past. I'm an engineer, although I consider myself a good person, despite that. And that's basically my main viewpoint. Let's talk about food purchasing. There are some references that I can share. And I'm very interested on showing data, models, and evidence. Like they're trying to show all this research view, but also what has been our thinking. And the first thinking actually, well, and that's idea of multi-methods. We have surveys, we have a spatial analysis, but also ethnographies. And I have been very pleased on working for a long time with Paola Girón, which is a colleague from anthropology in Chile, who really has done very nice shadowing exercises, looking at things in space. And I start with that. And our first concern was, well, we have the food deserts literature in general about that tells where access to food, and we can go with that. But the first thing that we realized, and this is the context of one of the first studies, this is Santiago. We are proud to be second after Mexico, the largest metro system in the city. You see in purple how that covers in Santiago de Chile. And the first thing we realized was this. different, basically, vendors, informal food vendors at each station. And that was an annoying thing for of course, those who were in charge of the subway system. But then we started to see that there were a lot of dimensions regarding rhythms, appropriation of space, and conflicts, and also negotiation processes with authorities, a relationship with time use, because this is people who really was in time pressure buying things, and also something that is a process that we think it was understudied and not fully understood. So we basically started looking at this, and I will, sorry if I'm not so much in depth on this, but just want to highlight key things that I think has been important here. Is that well, Chile after US is the second more obese country in for OECD, and then is the realization of something that may be simple but important, is that sedentarism is not only about active mobility but also about time use and mobility patterns. And there are restrictions of pressure, the idea of time pressure, one of the colleagues was saying about that just today, and the idea that the food security involves a care infrastructure. So one key dimension is how these practices relate to mobility, to the things that I have done for several years now, which are time use. So that's one of the dimensions that actually are highlighted on when looking at these aspects. A second aspect are, well, we have supermarkets, local stores, but open streets or farmers markets, which are not these posh farmer markets in North America or Europe. They come from very even pre-Columbus history, where basically these open street markets are key and are local, but are facing issues because on the one hand, if being so important locally, they face, for example, problems with municipalities. Basically, they close streets, don't let the cars in. There are problems with schedules about that, of order. So there's also issues of authorities. So we wanted to see in a more traditional perspective of accessibility, what was the role of these open street markets? This is where I live in Concepcion, basically, and what I want to show just about is this is sort of a spider web. In the center of that spider is really downtown, which is very central in terms of the facilities, very monocentric, if you want, in terms of the mobility patterns, but with these scattered open street markets. And one of the first things we did is just map open street markets and supermarkets. And then you see a green, yellow, and red. Well, green is the cheap price of fruits. Green, cheap, yellow, intermediate, red, expensive. So we have a big segregation in terms of prices, but also in terms of the locations. And then what we can see, of course, is not that they're more affordable, but we have a core periphery structure here. And a core periphery dimension that is related to homes. And that's an important thing here, that then mobility is not only related to homes, but also to workplaces. So when we started looking at accessibility to food, it's not necessarily the only way is looking at homes, but also looking at workplaces. And then we see the complementary in patterns. But then, and what was key here was looking at accessibility in terms of open street markets, and I will go a little bit fast on this, but then looking at specific populations. So, for example, seniors, 10-minute walking distances to open street markets, and we look at, in this case, 4 cities. And one of the key dimensions here is the intersectionality between older population and low income was very key in the regards that this population had a very high access to open street markets compared to other groups. And more than that, although in general they tend to have lower access to food in terms of the space, they are in much better position when we incorporate open street markets. Why this is important? Because then we brought this case to municipalities, and we brought this case to in this case, the regional governments, just to show the importance of OpenStreetMaps that even weren't mapped previous of this research. But then the question about food, but also time use and time pressure require for us, and this is looking at a little more individually, and I will pass a little bit on that. We did an intercept survey looking at food purchasing and food consumption. So to which extent these things just is not static, but also dynamic in terms of the behavior. So we look at, and we wanted to relate these two things, because then is when the mobility works in place, and what are the differences between the different groups. So what we did was basically looking at the classical dimensions of built environment, but also questioning to which extent, for example, what we call healthy lifestyle, what was that related, and how that was in particular related to transport and to transport access. And transport access in Chile is very important because half of the population doesn't have a car. So when we're talking about going to cars or not going to cars, that has a direct implications, at least in terms of equity. So what we are looking at here is trying to incorporate the dimension of food purchasing, but also in terms of transportation habits. And I know the BMI is not the best indicator, but kind of indicator about healthy lifestyles. And we got over there is a few of things related to healthy lifestyle, like healthy food access. So healthy lifestyle has a correlation with food access. The increasing access to multiple modes of transportation impacts food purchasing. So having a more mobility tools about that is really important. Active transportation modes may not necessarily lead to healthy outcomes, at least in our survey. So it's a precondition, but not necessarily a key dimension. If we are looking at from this perspective, and time pressure is linked preferences in terms of store type. So we look at also store type and the variety of store types. And when we are looking at that, what we, of course, being able to shop in different places seems to be much better correlated with health. And that implies some differences in income. And when we went farther with more data, because we have to collect more data, always know more things. And one of the key things here was trying to relate with other dimensions, in particular with attitudes and also lifestyle, and in particular with social capital. So to which extent if you give or receive advices for cooking, and looking at the more detailed mobility and time use and trip characteristics. So just to be quick on this, some key results about that is that food consumption and purchasing needs a more integrated analysis. So it's not only looking at demographics, it's not only looking at the food supply, but also looking at time use as a central component of understanding food access, social capital as a key dimension as well, and then trying to disentangle factors like attitudes, healthy diet index, and attitudes and grocery shopping as a key mobility dimension to understand diet. So basically, as a wrap up of this food thinking, eating emotion is key to understand this invisible large nutrition component that is embedded in mobility, and to which extent public spaces are carrying spaces. And I was even thinking on the parallel when we talk about popular transit, maybe this is popular eating, and somehow this is a new way of thinking, or a way of thinking. I think everybody in Santiago that purchases this think about that, but a way of thinking also mobility and eating. And the idea of open street markets as a key central dimension for caring cities, continuing with what Tanu was presenting today morning. And another key thing is that spatial proximity alone does not define diet quality. And I think that's very important because we tend to look these dimensions very statically, very much in the food desert category, and not necessarily in terms of this more behavioral dimension. And also group differences, lower income groups and women consistency show poor access. And that is really key here. So let me talk about care. We haven't, and of course, and this is the continue involves that, yeah, looking at food purchasing, looking at food components. Eating is a way of self-care, but it's a way of caring behavior. So our next question was, well, how that relates into care, and I don't want to, I don't like to criticize other people who really we build upon that, but I really don't like the idea of care mobility. We tend to think very much as care as another purpose, trip purpose. Uh, and I think it's much more than trip purpose. And if we think about care mobility only as a trip purpose, we tend to miss a lot about that. It's not only what is the differential effect if I add a coefficient of a female in my equation, but it's more about the process. So how do I, well, and so again, we have the idea is, and the need is for multi-instruments. And how do I present to my colleagues, engineers, about care? Well, I introduced Rosario. Rosario lives with Daniel and Monica, who's a baby. At 7:45, departs from home with by car. This is a middle income. Sorry, Karen, but I think it's very important to show. It's a middle income, but it's a very struggling middle income family. I think that it's important to see that because the contrast with non-car users, we'll show examples later. So we have Rosario and Daniel. They take the car with the baby at 7:45. They arrive at 8:03 downtown, where Rosario enters to the employment, and Daniel continues with the baby up 8:20 to the mother-in-law's house, to grandma, who takes care of Monica. At 5 p.m., Rosario leaves and Daniel returns, lives in a park, parked the car, and at 5 p.m., Rosario takes that car, moves to grandma, stays with Monica and grandma. Then at 7, takes the car. At 7:30, takes Daniel. Daniel arrives into the car, and then at 8 p.m., they arrive at home. So they've been 12 hours outside. So when you show this, I say, well, so what? Yes, well, we have several dimensions that I think are important to continue discussing when we talk about mobility and gender. First of all, interdependence. Of course, there are many women that tend to do this alone, but in this case, we have sort of a complex strategy about caring. And again, talking about what we were just discussing, that job or work trips are not necessarily the most important ones. Really, all the structure of the strategy is built upon Monica and is built upon caring. Actually, Rosario lives at 5 p.m. In Chile, we work up until very late. We work until 7 p.m. She negotiated to get early at 8 a.m. rather than 9, but so that she could leave at 5 and she could spend some time taking care of Monica. So there's a number of negotiation process of interdependence between people, and also in terms of this complexity that we don't see. But then when we map in time space, as many colleagues like to do, as I do, the longest trip is not the work trip. This is in time and space, so this is all the days of the week, and this is in space. The longest trip is the trips to grandma. So if we measure in vehicles kilometers traveled, the longest and more complicated trip is the care trip, is the one that really pushes into externalities and design. And then we have networks. This is Rosario's personal networks, where we have a number of people around, but then the central focal point is her mother, but because she's the who takes care and also relates to all the relationships or caring relationships. So it's not only, again, not only the individual unit of analysis, it's not even the household unit of analysis, but it's the extended family and even the social networks as a unit of analysis, if you want to understand this. And then we have other dimensions that I think are important to integrate in our discourse. There are some of them here that we have done with Paola in the qualitative work, but more explicitly, for example, what we call chains of care. Yes, the first person in the left is someone who has a high income, but she has someone else who she hired to take care of the children. And at the same time, that person has to take care of their own children with some neighbors. So when we look at care, we cannot only look at this isolated in one unit of analysis or one household, and that has implications for different spaces. Or temporal rhythms. For example, in this case, there's people who basically take turns to bring the kids to home, to the school. And that's once a week, which means that we have to look at these temporal rhythms. Or things of care that are very important, for example, when we are looking at the design of public transport. Or network infrastructures. What are the barriers in terms of body, organization, institutional, or the change of places, how they play into the role. But then there's also, and when we're looking at the quantitative dimensions of care, we tend to look mostly in travel behavior, the left side, transport and time use. These are some figures that we have developed in the past. This is a method that tries to classify strategies of transport. And in general, when we look at variables to understand strategies of transport, when we tend to look at things like time use, well, transport, of course, frequency of use by car, by public transport, etc. Our time use, how long the people spends traveling, but also how long spends working, entertaining, etc. What we ask ourselves is, what if, and then we have profiles, which are those who are shown here. We basically look at travel behavior profiles. The question is, does it make a difference when we incorporate other variables like care activities, number of activities with dependent people, and time spent with children? So it's the same data, but now highlighting mainstreaming care as a variable of segmentation. And of course, we have different results. We have, in this case, 4 groups, and these are the different income levels, gender, occupation, and car availability. And the interesting thing is that then we highlight 2 groups that have different caring characteristics. The second and the 4th group over there, pedestrian commuters with caring activities and car users with caring activities. And then we have, if you see car availability and occupation, these are very different in terms of income, in terms of the availability of car. And of course, in the second group, we have much more low income groups, a lot of women who work at home. And then we can start looking at, in a more, I would say, integrated way, time use, travel patterns with all these segments that are related to just looking at incorporating different variables in the same set of analysis. But then all these things are related to resources. So the next step was thinking about what kind of resources we need to do. I remember a long time ago reading Tim about aging populations and say, well, the problem is that we are trying to look at autonomy, but that has a political perspective. Autonomy involves that the state will be less involved if we basically are solving the problems for ourselves. So one of the nice theoretical approaches that I think could help to understand our ideas of caring is what is called the diamond of care, which is Razavi in 2007, colleague from another, he's, I think, from political sciences. And when we look at, basically the idea is looking at also care from the resources viewpoint, but not from an only, and in the sense of with who we rely upon about caring. So basically, someone could be related to family. So basically, family would be the help, as in Rosario's example. The state and public care activity services could be something that we could rely upon caring, or the market. We can basically buy in time. When we think about time pressure, for example, as like in to come back, in the fourth group, basically most of them, they didn't spend so much time on maintenance at home, but a lot of time with children, which means that basically we're buying time in household maintenance. So that would be market or community, to which extent other organizations are related to that. And the question of, and why I think a diamond of care could help on this, because it could help us to link time use, resources, and also mobility patterns. So what we did basically was incorporating, and I added this boring table just to show what kind of variables we need to incorporate in our analysis. Is and something that actually Tanu was saying in the morning, I think, is obligations. Who takes care within the household about who, and what kind of degree of responsibility the person has. This is something that we haven't asked about ourselves. And I think it's very important, because when we're looking at power relationships and what we were talking about yesterday about the need of not looking at caring only from the perspective of women who has to care others, but also from the perspective that we have to be a caring society, and then we're a man somehow. We have to think about degrees of responsibility, and also the use of course, of these resources. As we perform some kind of a method to self-organized maps, which is a segmentation method to really analyze the different patterns. And we have different patterns. Of course, this is something that we could make a little more, continuing doing this work. Actually, this is the only piece of work that is not published, but is in progress of work. But I wanted to show this because it starts to looking at things related to, for example, the group B, which is solo burden bearers, which is basically predominantly women with low car ownership, and where care is concentrated in one person, which is a key reality in Latin America and other places. So to look, just to be able to look at that in terms of the resources they have, but also on the way we look. And we can map that. I will be in more detail. Where are these profiles? And how these profiles in terms of the mobility behavior, but also in terms of the income, in terms of their social demographics are related, and what are basically the resources they have? Because and that's very interesting, because when we and I like that Tanu says, yes, in Latin America we have had a lot of policies. In Chile in particular, there's a national care policy now, but a national care policy needs to be actually substantiated by resources. We need and when we're looking at who really uses public versus market resources, these are very differential dimensions that for us in terms of the mobility research is key, because it also involves certain mobility and different mobility patterns. Just some examples about that. If we're looking at, for example, dominant modes between these different profiles, and also in terms of characteristics, we see things like, for example, even the kind of care. We tend to think a lot about senior children, but then we haven't looked at so much about caring seniors, which is an increasingly important dimension of this. We are also looking at an ethnographic other dimensions of care, even care community pots, or caring or pets, or a number of other caring dimensions that are also important for life. But in this case, we look at children and seniors. And then, even in a very narrow-minded perspective about modes, we have different modes to think about. And in particular, in this case, in the case of this profile B, the solo burden, for example, it's not only walking, and it's a medium use of transit, because there are a lot of trip chaining difficulties, but it's also, for example, taxi and mobility as a service. So a little bit, someone was talking about this, about the importance of Uber and other modes in this case. And we are talking about low-income groups that need to rely upon mobility as a service to really take care of their needs. That at the same time use a lot public services, compared to, for example, the profile E, which is self-reliant, who could use all transport modes, but at the same time can buy in time because it uses a lot of market resources. So a couple of findings on that. Well, we have care activities are systematically invisible. They are bundled, interdependent. There is specialization, but it's a specialization at the same time. And also, of course, we still see disproportionate care burdens for women. But then what I think is that we need analytical frameworks that incorporate the whole population rather than looking at differences between women and men. And the last thing that I want to say, which is a little bit different, but I think it's interesting in terms of some of the things that we have discussed in the past, is about spatial accessibility. And this is a method, but I wanted to give the context of the method, which is, I think, maybe interesting in regards even to the governance that we have discussing. I had the honor in the last 4 years to be part of the board of the Chilean railway company, and a lot of learnings about that. But one of the interesting things that happens is I'm in the board, so I basically try to define strategy. So in the first strategic meeting, all these fancy strategic meetings with people in tie. I never wear tie, so I was the black sheep. But anyway, we have this strategic meeting, and then we define it, and this is from the report of that year, 6 key goals that the Chilean company had to have. Basically, double the passengers, triple the freight, being carbon neutral, have more female workers, which I think it's interesting. Financing, basically going to that. And then I say, okay, I'm a transport researcher with more accessibility. So of course I was part of the board. I said, yes, let's have more accessibility. And if you can read in Spanish, they're all in blue are all basically the goals, the numbers that are there. So you have how many passengers, how many freight, carbon neutral for 2035, the zero financing in 2039, carbon neutral in 2035, and inaccessibility to be defined. And that goal was to be defined for the 4 years I was served on the board, because basically the question was, what do we do with this? And then the question was, well, maybe we're pushing a goal, but without measuring. In this mindset, in this company that at the same time has to sell these goals. I'm not saying that the method that I will show here is the best method. I think quite probably Tim and others will be against one of the key technical components, and I agree with that. But what I want to show is to which extent we really need to talk with this at this level when we are trying to push things in terms of accessibility. And the last thing about policy, and later I will show the method and I will shut up, is that on the one hand, have these 2 large projects, which are the ones that I will present. But then there are a number of pilots that we developed during these 4 years that were low cost, that were for basically communities that actually had nothing to do with finance or double the passengers, have another skill. So how do we do that? Well, we talk about they provided more accessibility, and at least we got that basically buy-in or acceptability from policymakers, but they weren't able, or we weren't able to incorporate as a goal. So what we did is we incorporated what we said, well, let's see what Karen Martens have done and others. So what we try to incorporate is a transport justice framework, one of the several that are out there. And the idea was just trying to measure accessibility explicitly. And more than, I think this method has a lot of limitations, but I think it's useful to incorporate the conversation of justice in project appraisal. So basically the method involves looking at basically 2 dimensions, which is easy to movement, which is speed, and accessibility, which in this case was jobs, but we also look at accessibility to several places. And then you can start looking at, if you're on the lower side, you can subsidize, or improvements are obligatory, and if you have, and in others, basically when you have higher levels, that may be not necessarily subsidized, so you can self-finance. I don't want to go to the theory, just this is basically a way of incorporating justice in a non-perfect, but I think in a crude way in terms of looking at what is called this affordability index, which looks at how accessibility changes when there is a project. And let me see if I have the map. Okay, I will show this first map, and then I will go back a little bit. What is the context? The context are two large projects, which are the blue and the red, which are basically two suburban railway projects. They will be very important for the company. Basically, they will bring, I would say, 40% more of the passengers that already are in the entire country, and they will basically connect to suburban areas in the northern and in the west south part of the city. So it's very important projects that have had passed all these traditional transportation modeling, travel demand things that I teach to my students and give me my job. But then, and have an appraisal, cost-benefit analysis, everything checked. But the thing is, well, how we can use the same tools, a little bit tweaked, to look at a little bit transport evaluation. So basically what we do, and the method is related to identify population groups, identify opportunities, measuring accessibility, potential mobility, and a scenario evaluation. And we basically evaluated these scenarios with and without in terms of accessibility. And what we can find, and then the key thing here, we have all the data except car ownership, because of course that's not relevant when we're looking at modeling. It's relevant to see income groups, opportunities, their networks are perfect at the very detailed network link level, but not necessarily things that are very important for us. The key dimension was, what was the change for people who didn't have car available compared to those who have car available. So basically the appraiser and the base case was looking at what are the differences, and you can see that the public transport users are more in the gray area, which is basically low accessibility and low mobility, compared to car users. So there are huge differences in terms of the potential access, but also in terms of the travel times. And when we are looking at different base case scenarios, baseline scenarios, which are the two ones, and the both projects, what we started looking at, of course, is that this makes a huge difference for non-car users. And it's not only that, it's like seeing the grass grow, but also is that we can see these differences and we can measure them. In this case, for example, we measure this index in terms of the access to different kinds of facilities, universities, supermarkets, schools, libraries, work. And then you can even work in cost effectiveness analysis. So basically, how much money involves to change that that index somehow. So it's a little bit even some indicators about that appraisal that may not go to the main pages of the project appraisal, but it may go to an appendix that will buy in even more this strategy. And actually you can see other results on that. Of course, and a little bit coming back to the discussion we had in the morning, cost and benefit, and overemphasizes benefit for high-income commuters is we need multi-criteria analysis, definitely, but then we can start looking at incorporate. But there are tools that we can use to incorporate accessibility into the discussion. And the discussions we have had with this particular case with the Ministry of Social Development, which is in charge of the methodologies in Chile to do project appraisal, is that, oh yeah, maybe it's a good idea to incorporate accessibility on the appraisal and looking at accessibility to different groups, because then that will improve the acceptability of some of these projects. So in general, and as a synthesis, we can think about maybe different dimensions here, macro, meso, or macro, but in general, the other idea is how we can bring transport justice in a more explicit way, in being in charge about the complexity of these processes, not oversimplifying some of them, but also using some of the tools that are out there in that regard. So thank you very much for your patience.
James says that I have to stand here so I can see who's put their hand up and be more fair. So, we got any questions for Juan, please? I didn't think. None whatsoever. Yes, at the back, Charles.
Yes, thank you very much. And a very good after presentation. I just want to go back to the indices used to measure care.
Here. The sorry, where specifically? Do you know where exactly? Measure care.
Like you want to look at care.
Just ask the question, Charles.
Sorry?
Just ask the question.
And then maybe I can know the context.
We're not sure where you want to go, so just ask your question.
Just what are the indices to measure care in mobility?
To measure, indices to measure. We haven't developed any index, and I think that's maybe something I have to avoid. I had tried to avoid, because I think when we are looking at care, more than measuring, I think we need to understand the processes behind that. That's very difficult. And the way of looking, and I'm an engineer, so try to measure things. And yes, and the thing is that everybody says yes, that is related to my life as well. But how we can translate that into understanding behavior, somehow that means, for example, looking at what we did here in this work, basically looking at segments and then trying to understand that, of course, travelers and people is not homogeneous. They have different needs. They have different strategies. And this comes from an earlier work that we have done in the past, thinking about time use and travel as strategies, the strategies of which mobility tools I have, which time availability I do have. And actually, if we go beyond in a diamond of care, which strategies of resources I have to buying time or to perform certain activities. I think that's the key. I wouldn't go to looking at indexes. I will go to showing processes, maybe in a qualitative way, but as well in terms of quantitative. Yeah, thank you very much for the question.
Right. Could you elaborate a little bit with the nature of the company that you were on board? So I guess it matters because financing needs to be considered.
Yes.
And when you want to integrate the accessibility, then you have to consider efficiency and equity. I mean, the nature of the company will decide whether you will consider efficiency more or whether you will consider equity more. What's the balance that you do?
Yeah. Thank you very much for the question. Well, this is a state-owned company, and the way it finances the infrastructure is mostly through loans to banks or financing in the longer term. You know what every company does. They borrow money 30 years, and then they basically roll over the debt. But the interesting thing about that is that most of that debt, which is huge, is mostly, and actually most of the companies and banks finance the large projects, and actually sometimes even they index their debt to the large projects and not to these small pilots that somehow are very important for the company, but of course operationally they will never be able to be paid, and they imply certain financing directly from the government. So the idea was exactly, well, I did the opposite. I showed with the large projects, of course. I cheated a little bit on that. But the idea was exactly to show that, yes, the financing, for example, was going to be achieved anyways with these large projects because you have a huge demand in terms of suburban trips, for example, in the case of these projects. But then you needed to think about what kind of other goals as a state company, as a national company you need to do, and how you can basically make buying the idea of these pilots to small communities. And the only way of doing it is just putting that up front, something that wasn't in the other 5 goals. And then, of course, then to which extent you have certain measures that could basically show complementary about this social need. It is not just a political discourse. That basically is the context. So thank you for the question, Gabriel.
Just wondering if there's Jackie, and then Jim.
I'm just really curious about this too. So, like a lot of those indicators, you can do things to try to increase, but with accessibility, I'm curious, what would you do to try to increase accessibility for rail? Like what creative things could you do to increase your accessibility?
So it's really accessibility to facilities what we measure in that regard. So it's really what we have in the, let me show you the map maybe. What you really have is people who have very low quality public transport, and so they have low accessibility in terms of the travel times, and also in terms of the opportunities they already have. So it's really incorporating those opportunities was what was the main goal in that regard, rather than, of course, things more related to the access to the transportation system. I don't know if that was the.
I'm still just kind of curious, if it's a goal to improve it, what, if anything, can you do as a rail company?
Well, this is really the case to build infrastructure. So was just in the appraisal stage. So in that, what happens is that you have these two large competing projects that you know will get even profit to the company. In this case, actually, it's interesting because the idea is that you will never finance infrastructure, but you will finance operational costs with these large projects. But what do you do? How do you show the relevance about these small scale projects and pilots that you perform in other communities that will not achieve these other goals? So it's really a way of somehow putting in the conversation as a goal of the company, this idea of accessibility that wasn't there.
Right. I guess the thing I was thinking about is if you can bundle some of those smaller projects into the infrastructure project to address the accessibility. So not necessarily shifting the large scale infrastructure, but bundling those things.
I agree with you. But but there are two issues that I think very important for this community. On the one hand, this is really different locations, but also the system, the methodology does not allow for bundling projects. And then you need to show by their own what is the value of those projects. So that was that it was so needed to incorporate that explicitly.
Thank you.
Yeah.
I don't want to labor this point, but we work a lot in this space, and we invite people to adopt SDG 11.2 about convenient access to public transport. And there is a methodology for that to work out a percentage of people with access. It doesn't pick up the justice point, but it does give you a number.
Yeah.
And you can compare that for every station and for every, and a city level as well. What we argue and what we're working with UN Habitat about is to try and improve the quality of that experience, so that would just take it another level. But it's this word about convenient access, would be a starting point. And we would always just say, adopt 11.2 as a starting point because there's already a methodology. Then you've got at least some data there. And then we can talk about quality and who's got access and disaggregate the data. But so I wonder why you didn't go with that.
Well, we wanted to incorporate justice on the one hand, and the other thing is that we wanted to be in that first stage about basically looking at accessibility to opportunities, and the other thing was that some of these pilots, which were not this case, use the current rail stock. So somehow the idea of quality of having a better quality of service could be problematic on that regard. And so that's why we wanted to keep a little bit out of that. But I think definitely that's the next step. And that's something that we just don't know. When we talk about justice, we tend to talk, in my opinion, we tend to talk about travel times and accessibility, but not so much about the experience of low-income communities. And what we have seen, for example, in other projects, in the railway, actually in the suburban Concepcion, is that we changed the rail. Actually, this is a Chinese Chinese trains. We can buy Chinese, which have improved substantially the quality of service. And not only ridership, but actually the inclusion of several communities have risen in a very important way. So I think we need some methodologies to really capture all those more difficult to measure dimensions as well, I think.
Just a quick question. I understand that these are the key targets for the company.
Yeah.
And the accessibility one, as I understand it, it was like a proposed new one.
Yep.
Was there any kind of benchmark for affordability? Because the ridership is one thing, but from an inclusion perspective, what happens with affordability?
Yeah, no, I agree with that. I mean, the issue with affordability is really political in the sense that this is a company. So somehow to put the discussion into fares was going to be complicated. So you have subsidies and looking at affordability was going to raise all the questions about who defines fares and what are the prices of taking another system. So yeah, that may be an alternative, an even better way of doing it, but it was easier in our perspective to really bridge that gap, looking at accessibility that we thought it was going to be a much more intuitive concepts for those who were basically looking at this and having some of the decisions. But I think it's a very good point, definitely.
Clarification question. Is there a framework for differentiated fares for public transport in Chile, more generally, but in Concepcion in particular?
No, because this is actually at the national level, and what happens is that, and we had that struggle all the time. I suffered 4 years, but because we have to define the fares, but the fares had to be somehow negotiated with the Ministry of Transportation because it's politically very complicated to rise the fares. But then as a board member, I had the responsibility of basically keeping up with the cost of the company. So we're talking about governance. This is an interesting issue as well, because who defines the fares is something that sometimes we just overlook when we're looking at these systems. So I appreciate your question.
I think, it is really important. Somebody was speaking to me today about a small rail intervention that's hardly covering anywhere. It's costing the government a fortune, and nobody's going to be able to ride it because the fares are going to be too expensive.
Exactly.
So it's like there's very little point in improving accessibility to rail services by putting in small schemes if what you don't get right is the price for using them, right? Yeah. So it's a valid point, isn't it? If you just spend all the money on that, then you suddenly realise, well, hang on, we can't subsidise the fares, you're going to have a problem, like we had the BRT in Colombia, in Bogota.
Oh, definitely.
Yeah. Okay, another question? Okay. We're a little 2 minutes, but
There was one. Right.
Here was one?
I'm sorry, if no questions, I want to follow up on this question.
I think there's one here at the front. Then.
Right. So I just want to follow up on the goals. I feel that accessibility might be something related to funding, and it's different from financing. The financing fund money to build it, and your accessibility will, for the long run, where you can get the ridership, get people to use it and be able to repay some of the debt. I think if you want to really build up this justice, and probably that's the direction can be packed more.
Yeah, but I think that's very important to put up front, because it's and again, it is related to how you finance each project. So on the one hand, the company borrows money for these large projects, but there's a pressure of basically being efficient and not spending enough money, which is, of course, goes to the fair questions, but also in terms of talking about how you basically, even thinking in individual terms. Me as a board member who has a legal responsibility of making this company optimize, how you really make the case for these other pilots.
No, I get you. And also, it's to be defined, which means you haven't said what accessibility components are there.
And how you measure.
Affordability could be a component of accessibility, as good safety and a whole load of other things, right? Did you have a question?
It's more like a provocation for you. But for me too, because you provoked me. Because you were talking about middle class and high middle class. And okay, wait, I have a point. And the question is, do you think that rich people or middle class people don't believe that public transport and sidewalks are important, and that's why government
government usually don't invest in that because in Latin America, public transport and sidewalk for poor. Yeah. And maybe if we try to, for example, I'm thinking in Bogota that Peñalosa was a mayor. He persecuted cars very, very sharply, very. And maybe if we try to do something like, I don't know, diminish the quantity, amount of cars and everything like that, you can create demand. Because in Brazil, for example, we have a decrease of 30% of the demand of public transport. And we have a problem because we don't have new customers. We have only people who are in jail at the bus. Yeah, you're forced to take the bus. This is something that I was thinking of because you made me.
Yeah, but just a quick thing, Karen, about that. It's I think it's a debate that comes from the Transantiago, the big revolution is in Santiago from the 2007. The goal of the government was to maintain public transport share. And I think that's still a mindset in most of the government policymakers. It's not to increase or to being, well, on the one hand, it's because we have a good share, a high share of public transport, but also it's really, I think, a limitation or a mindset that is very difficult to really get into against that. So, but I think that's it. And when you talk to policymakers, all of them talk, we really want to keep public transport users in the same share, the same amount. And the key thing is really to improve the quality of service of public transport so that they don't move to cars. If you think on that, and that's the policy mindset that you see even in very progressive governments that we have in the past.
Okay, thank you, Juan.
Thank you very much.
Indeed.
Thank you very much.
That's a stop share. Say it.